This is a part of our COVID-19 action trainings, and with the COVID-19 pandemic upon us, like the faculty of the Columbia University School of Social Work, we're really passionate and wanted to mobilize to form this action group where the mission of it is to be monitoring the developments and disseminating information that can be useful to us as social workers and various clients and populations and communities that we're serving. So it is my pleasure. I'm excited to introduce you guys to Amy Kapidia, who's one of our lecturers here, and then Samantha Winter, who is one of our associate professors. All right, so I'm gonna turn the camera over to them.
Hi, everybody. Thank you so much for being present today. I think Sam and I are very excited to be a part of this great series and being involved with our CSSW colleagues for with this action team and being inspired by their meaningful and dedicated work. It's been really a great experience. We wanted to start off this morning by acknowledging what May marks, and Dean Begg shared with us with the CSSW community this morning an email recognizing that May marks Asian Pacific Islander Heritage Month. And we wanted to take a moment to acknowledge the rich culture and history and diversity and distinctive and far-reaching contributions and achievements of people, Asian American and Pacific Islanders in the United States. And we want to also especially pause to reflect upon the recent backlash and anti-Asian sentiment that permeates the everyday lives of Asian Americans and Asian immigrants in the US and in fact across the globe. We're once again reminded of the pernicious effects of racism and discrimination. And not only do we reject these senseless diminishing acts, but we vow to use our voices and commit ourselves again and again to the necessary work of rejecting stereotypes and prejudices, confronting our own biases, and dismantling oppression. As Dean Begg stated, when one of our communities is affected, all are affected. We stand by one another. So I just share quickly a little bit about myself. I've been fortunate to work across clinical and research and academic settings, focusing on overlapping areas of psychoeducation, serious mental illness, and stigma and discrimination. I have to share, though, my most rewarding experiences have come from learning from my students, observing their professional growth, and witnessing their strengths and compassion and commitment to the work of social work and social justice and oppression. I want to share with you today as well that I am participating in this psychoed training, identifying as an Indian American woman, which incidentally is sort of meaning a little bit more today than it typically does, given what I just shared earlier. I recognize that I hold several privileged positions, and it's important for me to take a moment and recognize that I try to be in a space of continuous growth. I see myself as a work in progress, and I try to reflect on my privileges and my biases, and I especially want to share with you today, given this experience, this collective experience of the COVID pandemic, that one privilege I have is being able to work and teach from home and take advantage of the tremendous technology and other resources that Columbia has to offer. I'd like to add too that it's been a great pleasure and honor to team up with Sam and share and learn with all of you today.
Okay, I'll jump in here. Thank you so much, Amy. I am so grateful and honored to be here today with all of you and to discuss what I think is a really important topic at all times, but as we're sort of facing this pandemic together. And I want to thank Tiffany from OPE and Chris for being here to support us and to engage in this conversation. So I'll just start with a little bit of a brief intro to myself, as Amy did. My name is Samantha Winter. I usually go by Sam. My pronouns are she, her, hers. I'm an assistant professor in the Columbia School of Social Work. I work primarily with women in poor urban communities in East Africa when I'm doing research. I focus on issues related to access to health and health-related services, women's health and experiences of violence, and the role the social, built, and natural environment play in these phenomena. As a white American woman working largely in a region of the world that was colonized by white folks, and with women who embody layers of marginalized positions and identities. I'm in an ongoing process of self-reflection and evaluation. I do not see this process as having an endpoint. I view it as a constant, everyday, moment by moment process of trying to understand and unpack my positionality and my biases, and doing my best to interrupt my thoughts, actions, and behaviors that perpetuate systems of oppression, dominance, discrimination, and inequalities, and to advocate for the disruption of these systems. Throughout this process, I try to maintain awareness of the privilege and power that I hold and the problematic positions I occupy. So this is kind of the lens that I've tried to apply in coming to this training, and also in the work that I do and in the classes that I teach.
We just wanted to highlight the other opportunities to connect and share knowledge with psychoed, the other psychoed modules that are coming up, as well as some non-psychoed opportunities as well, including motivational interviewing, a training and discussion relating to PROP, and a policy series that I believe starts on in a week from today. And you can visit the website that you'll receive in the slides. So our agenda today is to share a little bit about psychoeducation and our approach to the work, and we'll talk about stigma and the way we've framed it and conceptualized it in relation to COVID-19 pandemic. And we'll have a significant opportunity to hear from all of you about your experiences and knowledge during this time. So these are our goals. We have considered for the psychoed model these four sort of larger components. And Sam will discuss in a little bit our approach to the work, which is sort of echoed in these goals. And we hope today to reach these goals through a collective sharing process with all of you. So I won't read them out. I'll highlight a couple things. And the first one I want to highlight is for all of us today to consider the historic and systemic oppression, racism, stigma, and discrimination, and the unique ways that we're sort of finding out as we go every day in which this COVID-19 pandemic has exacerbated existing structures and the impact of those on individuals and communities and organizations. And we will share a model in just a little bit as well of how we've sort of tried to understand this phenomenon. So we are using a psychoeducation framework, and I'm just going to spend a few moments talking a little bit about what that means for those of you who are less familiar. Psychoeducation is an evidence-based model. It has its origins in the field of mental health, but now it's expanded to a lot of different fields. And it is usually in a group format, but not necessarily. It often uses a curriculum as a starting point, and it can be very structured, but the idea is to present in a way that's much more fluid and working with the expertise in the room, and we certainly hope to do that today. Psychoeducation allows for the transferring of knowledge, and again, it's facilitated by individuals as opposed to being led by. We firmly believe that for today as well, and we look forward to learning from all of you today. We encourage, one of the principles is notion of collaborative community of care, and we encourage that today by having you use the chat as you've already been using, which is fantastic. And we hope that you continue to do that throughout, and we'll prompt you at times, but we invite you to share comments and questions with each other and strategies and knowledge that you've been learning as you've been going through this pandemic experience. We will facilitate self-reflection through the asking of questions, and we'll hope to draw out some of those personal and professional experiences that you've all had. You know, I can say a little bit more about psychoed, but I'm probably going to hold off. So if there are direct questions about the model, we're happy to address them as we go forward. Sam?
Yeah, So we wanted to take a minute to talk a little bit about the approach or the frame that we're using to have these discussions today. And I'm sorry because the beginning of this is very laden with kind of the theory and the housekeeping aspects, but we promise we're going to get into the discussion components of this as we move along. But just so briefly, our approach to exploring issues of COVID-related stigma, racism, and discrimination is really coming from a larger systems perspective. And so what we mean by that is that we feel really strongly that historic and systemic oppression must remain at the forefront of our minds as we look at the ways in which stigma, racism, and discrimination exert their effects on individuals, families, communities, and society. And so these systems of oppression exist and are perpetuated on many levels, ranging from the global to sort of the local and individual levels. We carry out our lives in a system of opportunities and constraints that are often defined by these systems of oppression. For example, access to resources which are, innately influenced by these systems of oppression, affect the power of choice of individuals and communities and influence their risk and ability to mitigate consequences of COVID-19. So kind of while we think about this, while we think about the fears, the unknowns, the loss, and the grief arising during this COVID-19 pandemic, we kind of want to think about how these experiences are exacerbating and perpetuating many of the existing prejudices, inequalities, and systems of oppression. As we think about this again, creating, how these structures create deeper divides and significant strain and stress and increase health disparities among those who are already marginalized. So that's kind of the way that we're trying to frame these conversations. So as we're doing these self-reflecting processes, thinking through this framework and thinking about how these experiences kind of relate to these historical or larger systems of oppression. Amy, are you?
I'm ready.
Okay.
So don't be scared by this kind of crazy slide. But so speaking of self-reflection, Sam and I have thought a lot about how best to approach this concept of stigma and as it relates to, in particular, this COVID-19 pandemic. So I want to sort of have a disclaimer that this is an absolute work in progress. We are conceptualizing as we learn every day, and we invite you to do that as well. So this is a framework that we're putting forth today, that we are using and drawing upon three very prolific authors who have done a lot of work in this area, Lincoln Phelan, Patrick Corrigan and colleagues, and the Stengel and colleagues who have recently published a discrimination in health framework. So there are a number of reasons we've sort of chosen to utilize the stigma model, most of which we'll sort of touch upon as we talk. But it allows us to sort of look at individual and collective health outcomes, as well as really recognizing the impact of stigma and multiple stigmas on people's trajectories in terms of health, and then contributing to health disparities. So I'm gonna sort of walk us through a little bit, but then again, we'll have more details as we go forward today. You can let me know if it's a little bit too heavy or whatever, and we'll just sort of move forward to more of the sort of, interactive stuff. But I do want to point out that driving this entire conceptualization of stigma is historic and systemic oppression, and Sam touched upon that as well. That really is a focus in understanding the deeply rooted oppression that exists, and then the interplay of something like COVID-19 on top of that and how that affects people's lives. The process of stigma is not linear, and it's not really cyclical. It's sort of like a weird combination, as you can see from these million arrows going in many different directions. It's multi-layered. That is one thing we know for sure. It does embody individual and organizational and community and structural factors. The element of power plays a really significant role as guided by the works of Lincoln Phelan. What it does is allows us to examine what this phenomenon of stigma does, which is separation from what we say us and them, if we borrow Lincoln Phelan's language, based on these stigma markings that we'll talk about. The inclusion of power sets up this dichotomy that, interestingly, as humans, we sort of gravitate toward doing. And unfortunately, or fortunately, in some cases, we ascribe meaning to these dichotomies. The unfortunate part is we ascribe hierarchical value as well to these markings. And it sets up positionality of power and sets up the notions of othering. These are some of the strengths of considering the stigma model. Valued positions and identities hold power and have the capacity to diminish power. And as we'll talk about, the diminishing of power has direct implications for accessing services, for accessing resources, including health and mental health. We'll talk a little bit about drivers and facilitators next. And I'm sort of thinking we might leave it there for now. I actually do want to just mention intersecting identities as a part of this conceptualization of stigma. So we, in the mental health world, we talk about mental health identity, and we have a slew of markings that go along with that. And here we talk about health conditions, in particular, the COVID-19 health conditions of being stigma markings. And we also include in this model our multiple identities that all of us hold in terms of race, ethnicity, sexual orientation, gender, class, religion, ability status, etc. That's not an exhaustive list. And the interplay between these intersecting identities and ultimately the relationship with health outcomes. So I'll leave it there for now.
Great, so now we kind of want to dive into the actual exploration of these pieces of the conceptual model. So we're just kind of using the conceptual model to guide the discussion or conversation, but really, we really want to hear from you, and then we'll provide some sort of examples of how this might look right now during the pandemic so that we can start to kind of recognize and name some of these layers of stigma, racism, and discrimination during this pandemic and sort of beyond that. So shifting gears a bit, we're going to dive into these components. This is definitely meant to be a joint exploration and sharing. We encourage engagement, so utilize the chat box as much as possible. Feel free to use the Q&A box. And then if a few of you want to share a particular story around some of these pieces, then raise your hand and we'll call on one or two people. So, Amy, will you advance the slide? Thank you so much. Okay, so as sort of our first step in this process, we wanna start by asking some questions and hearing from you, specifically around this notion of drivers and facilitators of stigma, racism, and discrimination. So in that conceptual model, there's kind of these pieces that drive, that come into play or drive the stigma marking or the discrimination and racism. And so we want to think about this specifically as it's rooted in the COVID-19 pandemic. And so we've put a few questions down here just to kind of stimulate conversation in the chat box. You don't necessarily have to answer these specific questions or answer them in this order. It's just, again, about kind of trying to stimulate the conversation and having a reflective process on some of these issues. So I'm just going to read the questions out, and then we'll look to the chat box and we'll look to hands that are raised to kind of get some feedback from the audience. So first of all, what are some of the drivers and facilitators of stigma, racism, and discrimination that you have witnessed or experienced during the COVID-19 pandemic? And then has the COVID-19 pandemic changed the drivers and facilitators of stigma, racism, and discrimination, and or exacerbated and perpetuated existing drivers and facilitators? So we'll start to look in the chat box and see what the conversation is there. Yes. So calling it the Wuhan virus, calling it the Chinese virus, so racism, blaming the Chinese and the culture for the virus. Naming of COVID-19 really matters. So the language that leaders and people use is really, really important. So that language can be a driver or a facilitator. Poverty is a driver. And I'm sorry if I'm missing some of these. I'm just trying to pull out what I can, but it's moving quickly, which is great. I love the engagement, and feel free to dive in and talk to each other as well. Access to technology and access to supportive services, Islamophobia and religion, scapegoating, families without technology or lacking access or fair equal education, access to testing, lack of testing in impoverished communities, so the community or the neighborhood context, the larger death toll among Blacks and Latinx communities, food scarcity, the language people use in power when referring, right? We talked about the language, media portrayal, anti-Semitism, isolation, historical oppression, i.e. slavery, unemployment, travel bans between particular countries, for example, China. These are moving very quickly. Criminal justice system, so incarceration, laws, law enforcement, access to rights, policies, and practices. Again, blaming, so blaming specific groups, children and parents, or assuming neglect and abuse when they lack technology or resources. There are so many. This is so fantastic. I'm like so excited to see all this dialogue, and I'm so sorry that I'm not capturing all of these. I saw mental illness and disabilities, healthcare workers, and exposure to risk, lack of empathy. And if I'm missing any, Tiffany, Amy, Chris, jump in here.
I had started jotting down some of the ones that were coming through, and you ended up covering them. So, we do have someone who is asking, by the way, about the conceptualization stigmatization model. Who created that, and is their work published?
You want me to? So yes, there is a lot of work published. My go-to authors are Bruce Link and Joe Phelan, who are a part of the Mailman School here at Columbia, and also the other one is Patrick Corrigan. And at some point when I can, I'll write those names in the chat. The model that you see on the screen has been crafted by us, so that is on our slides, but all of the components of it are across those two, and heavily drawn from our newest contributor, which is the author Stangl, Stangle. And again, actually there are reference slides. This is helpful. There are reference slides at the end of this, so you'll get those the direct citations.
Okay, so there's so much going on in the chat box, and I hope everybody's kind of looking into the chat box to see all of the ideas that are coming out. A couple of the others while Amy was talking that I'll just mention before we kind of move on, or this notion that, you know, white men, for example, in Michigan are not being perceived as harmful in sort of these protests that are happening, and yet, you know, when Black men or Black communities are out in protest or just out in general, that they are considered to be, you know, a threat. And so this dichotomy, this racism that comes to play as a really big structural driver, but that kind of is layered and comes out or manifests on every different level. So at the individual level, the community, neighborhood, national, global level. So keep generating stuff in the chat box, but I'm just gonna highlight a couple of examples that you may or may not have seen or thought about in the media that have kind of come up in this pandemic a bit. Yeah. Can you go to slide? Oh, perfect. Okay. So I want to, thanks, Amy, you're ahead of me. We want to talk a little bit about some of the different levels of these drivers and facilitators, right? So as you've seen in some of the chat box thread, like it can happen sort of on these higher level or higher order levels, but then it can also happen sort of at the individual level. Although we would argue that a lot of the individual level drivers and facilitators are also guided by or influenced by some of these structural or institutional drivers and facilitators. So a number of you have identified structural drivers and facilitators: racism, misogyny, some of these ones that Amy mentioned earlier, and we'll talk about again, some of these isms. As we've sort of defined them, they're societal level conditions, cultural norms, and institutional practices that constrain the opportunities, resources, and well-being for specific populations, especially marginalized populations. And so there have been examples of how these structural drivers and facilitators, again, racism, misogyny, religious intolerance, homophobia, classism, body terrorism, and other isms, have led to further stigma, racism, and discrimination of already marginalized groups, particularly during this pandemic. So we're looking at this kind of layering of the pandemic exacerbating a lot of these isms, right? And so all throughout this presentation, we've provided links to articles. So mostly media articles, some of the new literature that's being published. And these are really focused on how stigma, racism, and discrimination might look in the midst of COVID-19. And these are meant to be kind of a way of starting to recognize how these manifestations of stigma, racism, and discrimination are coming to play during the pandemic. They're certainly not exhaustive. I'm sure that you have so many more examples as well, but we just wanted to provide the links in case you want to dive into this further, or you want to look at how some of these pieces might look. And you'll get a copy of the slides. I know that came up as a question earlier. So right after this, you'll get a copy, and hopefully that will help in sort of your recognition and reflection of these issues in the COVID pandemic. Let's switch to the slide. Oops, sorry. No, that's okay. So I do want to share, thank you. I do want to share just a short excerpt. So a lot of you have talked about different manifestations of how racism might be playing into the kind of stigma and discrimination that's happening during this coronavirus. But I wanted to just share this short excerpt from an article entitled "The Pathology of American Racism is Making the Pathology of the Coronavirus Worse," because I think it provides a really tangible example of how racism, which is sort of this existing structural driver or facilitator of stigma and discrimination, is playing out in the COVID-19 pandemic. And we're happy to hear your thoughts about this in the chat dialogue as well. So Black people are at the mercy of everything that is flawed and dysfunctional about America's healthcare system, which has long been shaped by racism. Decades of research show the ways that racism produces a rigged system that drives disparities in health outcomes across lifetimes and generations. Higher levels of discrimination and bias are associated with elevated risk of a broad range of diseases, from higher levels of stress hormones to blood pressure to obesity to early death. All of these underlying conditions put people at higher risk for bad outcomes from COVID-19. It doesn't take a very stable genius to connect Black people's higher rates of unemployment, mass incarceration, chronic pre-existing medical issues, poor housing, homelessness, and less reliable access to quality healthcare to see why they're more vulnerable to increased viral transmission, infection, and death during this pandemic. So we really want to emphasize in this that these conditions and outcomes are a result of racism, enforced by racist policies and practices, not as an outcome of individual behaviors or choices. And we hope that some of these examples that we go through, we're not going to go through all of them, but that we go through kind of help you to reflect on or recognize how stigma and racism and discrimination might look during this pandemic. We know that this may also be triggering for some of you, so we want to remind you to practice self-care if your experiences align with some of the experiences that we're talking about here. So I'm going to skip the next slide. Again, these slides will be shared with you, so there's more resources for you at some point. One other kind of institutional level driver and facilitator that I wanted to talk just briefly about is this notion of authoritarianism, because we may or may not recognize how this might be playing into these systems of kind of oppression or stigma, racism, and discrimination during this COVID pandemic. So I wanted just to talk briefly about it. So I'm not going to go through the whole example. I'm not going to read through the whole example, but you can read through it or you'll have access to it. But what I wanted to note is that a lot of national governments, for example, have adopted authoritarian policies and practices in order to prevent the spread of the virus and to protect their citizens. And this is not inherently a bad thing. That is definitely not what I'm trying to say here. But there are many reasons why this sort of action, although necessary to protect human rights to life, may infringe on other human, social, and civil rights. And this plays a really important role when we think about these systems of oppression, right? Because even in the best of times, existing systems of oppression often mean that certain groups are unable to realize or are blatantly denied their human, social, and civil rights. And so, when we think about how this is playing out in the COVID-19 pandemic, authoritarianism can potentially exacerbate these existing stigmas disproportionately impact already marginalized groups. So that's just something I wanted to call out, as a way of kind of thinking about or reflecting on how some of these pieces, these drivers and facilitators might be playing out. Amy, can you skip to slide 17? I just want to make sure we have time for lots of discussion. So I'm skipping some of these examples, but they're here for you. Okay, so there are also these individual level drivers and facilitators. And I think a lot of times in conversation or even in media, there's this tendency to really focus on individual level drivers and facilitators rather than these higher level structural drivers and facilitators. But I do just want to take a moment to talk about this because I think there's going to be a diversity of opinions in some of these pieces. I'm just going to highlight one. So we feel that a lot of the manifestations or the individual level sort of drivers and facilitators are often coupled with historic and systemic oppression, right? But again, we welcome your thoughts on this. So for example, the fear of infection. So this is considered a driver and facilitator in stigma. It's a common, driver that we consider. And in this, you can see in this quote, there's this quote that says, "Illness is one of the fundamental fears humans have been dealing with their entire evolution." And so while it's true that we might, especially in the time of COVID, back away from someone who coughs or looks sick, or start to form assumptions about that person, sort of these early processes of developing this stigma and discrimination. But the question is, do we back away from certain groups more than others, right? If they cough, for example, or if they look sick. For example, we saw a lot of this in looking at Asian or Asian presenting folks. If they were to cough, would you back up in a different way, or would you react differently? And thinking about even before COVID, right? Would you back away from a child who coughs on a subway, or would you back away from someone who is presumed to be homeless? So, you may have different reactions or feelings about these pieces, but a lot of times, even our individual sort of drivers and facilitators seem to be coupled with other components. And so this is a process of kind of reflecting on our own perceptions, biases, and behaviors as they relate to this. Amy, I'm going to turn it over to you so that you can kind of move to the next portion of the discussion.
I'm going to quickly just comment on a couple of the chat comments. One was shared, I believe, by Tanya, who talked about, and I noticed this in a number of posts, who mentioned anti-Semitism. And I was thinking that this experience of the COVID pandemic and the bigotry that's happening around Asian Americans and Asian immigrants and immigrants in general has also sort of granted permission to just diminish power in a number of marginalized communities. And I thought that was important to sort of recognize, since several of you in particular had sort of mentioned that, and being mindful that many groups are being targeted for different reasons. Someone also mentioned healthcare workers as well, if they're in scrubs, being subject to slurs and fear-driven behaviors. And also I wanted to comment on, someone had asked a question, Shaniqua asked a question about culture and how that fits into the conceptualization of stigma. So where I think we see it fitting in is what I'm going to talk about now, which is two places that I'm going to talk about now, stigma marking and intersecting identities, and then the manifestations of stigma. So we will do a very similar thing. I'll sort of quickly share about these and then we'll ask for your inputs. Stigma markings, as I said earlier, are these sort of signals or cues that when placed upon people actually is when the stigma is applied. In the mental health world, you can have the label of schizophrenia. You can have the label of an identity of someone being Chinese, for example. You have physical characteristics. People make assumptions all the time about physical characteristics and the association to race and ethnicity. Accents can be markings. So there are lots of different markings and that then become stigmatized, and you have two manifestations in our model. The other terms that people are probably very familiar with are public stigma and self-stigma. But in our model here, we talk about individual, collective stigma practices, which happen in our larger society. And they include some of the drivers that we've talked about, stereotypes and prejudice and racism and xenophobia, et cetera. And individual and collective stigma experiences or internalized or self-stigma. These are the experiences that people who are being stigmatized experience, both of which have health and mental health implications, as we'll see. So right now, and I guess I wanted to say about culture is where culture can fit in is by both understanding cultural norms about various drivers and various stigma practices, excuse me, as well as thinking about cultural conceptualizations of health and mental health, and finally, cultural components being markers for stigma as well. So we have some questions as well for you to, again, answer whichever ones that are seem meaningful to you. What are stigma markers in your experiences? How are these embedded in historical and systemic prejudices and inequalities? Are there new markers we need to be aware of given the COVID-19 pandemic? And how are these exacerbated or perpetuated by the COVID-19 pandemic? So I will try to do justice to your comments as Sam did, and forgive me for if I'm skipping over some, and I'll ask again Tiffany and Chris to help us out there too. Perceptions of illness, yeah, for sure, those sort of symptom markers, absolutely. New markers, yeah, wearing scrubs, used to see that all the time and not even think twice, right? Denied access to being in grocery stores because of these markers. Yeah, people with cold symptoms. I mean, I know we're all afraid to cough, and it's, heightened allergy season too, right? Important to recognize the escalation of violent attacks against Asians, absolutely, based on the structural drivers that become exacerbated during stressful times. Megan, thank you for this great comment. Internalizing it can also influence behavior. And we'll certainly talk about those very important outcomes coming up. African-American men wearing masks. Yeah, Cheryl, absolutely. And we'll talk about that as well. The coughing and sneezing. When Asians were first wearing masks, they were stigmatized. I probably still now. Individuals who are elderly. Thanks, Amber. Not wearing a mask. Yeah, that's true too. If you're not wearing a mask. New stigma during this time is, allergy symptoms. We're thinking that everything is due and that we're all, at risk. It's really true. Any comments or thoughts on how these are embedded in historical and systemic prejudices and inequalities? If you want to comment on that. Noelle, you shared we are Native American and perceived to be Chinese. Children in elementary school are bullied. And Julie, single parents going out with their children because of lack of childcare, and being stigmatized for that. Families being penalized by caseworkers who are concerned of the transmission of the virus and visiting them in homes. Standing too close, yeah. People with sensory needs unable to wear masks or maintain proper social distancing. That's a fantastic one, Michelle. Thank you for sharing that. Another new stigma marker, those who are unemployed, on unemployment, I've been told, are now making too much and will never return to work now. Yeah, these stereotypes are so deeply wedded into the fabric of our society, right? And they just come out in these kinds of times. Information might not be available in all languages, absolutely. Not standing the distance required or walking are certainly markers. Individuals who are homeless in the city are predominantly male of color, and all of you probably saw the directive by Governor Cuomo about the subway shutting down and being cleaned and sanitized. Wearing a mask as a person of color in stores, yes, Candace. Nice to see you here, by the way. Those who live in New York are stigmatized and travel outside of the state. Shanique was sharing that she traveled to Maryland and constantly asked if you're coming from New York. Oh my goodness. The list goes on and on. I mean, it's really unbelievable. And these are fantastic examples and clearly things that you've all experienced or people with whom you've worked experienced. And we just want to acknowledge that it is super hard out there and really important for us to consider ways to care for ourselves. And we hopefully we'll talk a little bit about that as well today. Yeah, the stigma of being a New Yorker, right? Normally that's not really the case, I don't think. And so I'm going to share as well a couple examples, and keeping an eye on the chat too, Sam, in particular, if you're noticing things as I'm sharing these, please jump in.
Someone did talk about how incarcerated folks are sort of seen as less deserving, and I do think that's coming up a lot in the media.
Thank you. Absolutely, and in particular, in terms of protections for their safety. Someone mentioned actually earlier, to piggyback on that, people who are in, very low paying jobs who are risking their health and their lives. It's really important to consider. So what did I want to cover here? Let's see. A lot of the, I guess the main point I'll make is that a lot of these markings have existed, right? These existing stereotypes, these existing prejudices based upon historic and systemic oppression, again, interwoven into the fabric of our society and globally as well. And we're watching these play out in different ways. We're watching different groups being targeted in different ways, as many of you have talked about. I think one of the ones I wanted to point out that was sort of something that stood out to me was this notion of body shaming. So you see a lot of these like jokes or memes about either, you know, the COVID diet relating to food scarcity, which is such a massive challenge regardless of COVID-19, right? People really struggle with that in our country. And then now with COVID-19, food scarcity has become an issue for many people. And so people are associating those two. Similarly with being isolated and coping through binge eating and gaining weight, there's a lot of fat shaming happening, and just being mindful of how these prejudices are manifesting now or exacerbated because of this COVID-19 pandemic. And that's something that's happening with a lot of existing prejudices where they're being fueled by stereotypes and prejudices around COVID-19 in particular. So I'm going to highlight the importance of considering intersecting identities and multiple stigmas, as we call it, or in particular for multiple marginalized identities. One story that I will quickly share with you is relating to the third bullet here, where Black Muslims in the US are being disproportionately impacted by the impact of the virus, given their limited human agency to begin with. And furthering now with the COVID pandemic, furthering challenges with access to healthcare and insurance and access to other essential resources, given the invisibility that they have in our society and the experiences they have of social isolation. I'm gonna quickly move on. It's so hard to like wanna not quickly move on and also feel like you have to quickly move on. So I think I will, but I think we really appreciate your comments and your talking and discussing with one another. That's the beauty of psychoeducation and allowing that space. And even though we're in this sort of technological space that, you know, we can still do that to some extent. So thank you for participating in the way that you are.
I wanted to just mention a couple of things that I thought were really important that came up in the chat. So somebody said that, you know, it's really, when you're wearing a mask, it has a couple of different features that are really challenging. So one, when people smile behind a mask, it's very hard to tell. And so it's hard to read people's emotional gauge, which can be really challenging. And the other piece is if you're hearing impaired or deaf, reading lips becomes a challenge with the mask component. So I just wanted to mention those because I thought that they were really important.
Thanks, Sam. Yeah, it's so hard to not want to go to the chat because again, I'm seeing comments that are so profound and people are sharing personally, and I so appreciate that. The one that just caught my eye was the hearing the COVID-15, right? That terribly triggering and disturbing comment for those of us who struggle with issues with body image. So I hear you on that for sure, and I thank you for sharing that so openly, as well as a number of you. So we will just sort of move forward, knowing that we're going to continue talking with each other as we go through this training, and just share a little bit about the stigma practices, experiences, and outcomes. And I think, Sam, what do you think about sort of focusing a little bit more on outcomes?
Sure.
And we can certainly share about stigma practices or the ways in which stigma is manifested in the public sphere, as well as internalized stigma. I think a lot of you have already talked about some of that too. And then what are the implications? What are the outcomes of stigma and discrimination and racism that you've experienced or that clients have shared with you? And have these changed? And if so, how, given COVID-19? So again, take a few moments to sort of absorb those questions. I saw a comment about the bias against coworkers in relation to experiencing with technology, and as after just teaching for the first time online, it's a big learning curve, and I think there probably is a bias out there, unfortunately. Even within the healthcare systems, the idea of resilience can be stigmatizing. Yeah, struggling versus being a team player for the cause. I like that phrasing.
I would also add to that resiliency piece. It brings me back to some of the comments that people were talking about before in regards around like productivity and the expectation that you're going to be coming out of this with a new skill, and how that also like intersects with views of being resilient and being able to weather the storm in a way that you come out quote unquote on top.
Yeah, thank you.
Sometimes like that resiliency can be just doing what you can to survive. That is resiliency too.
Really great point. Absolutely. Thank you. There's so many. I love it. And I have to admit, I've kind of lost my place a little. So I'm going to just jump in randomly. Further putting those in poverty at risk, people living with family in small spaces with the risk of spreading. Remote learning has brought out a lot of changes, parents' lack of access and lack of education, needing to teach their children, and lack of time because they have to manage their work as well. Someone, Michelle, you mentioned there's been a positive impact about mental health. I hope that stays the case. Children in foster care are being denied court hearings and visitation, which compounds negative outcomes for families of color who are already disproportionately affected. There's so many impacts with children within the foster care system, and I've seen a lot of you commenting about that. Delayed access to health care for chronic conditions. Yes, absolutely. So people who have other issues going on, not being able to get the care that they need, given the constraints on our healthcare system, and something that we don't always pay attention to, that our healthcare system needs a lot of attention, right? Advocating for the release of individuals pre-trial and combating hysteria perpetuated by the media. Yes, absolutely. Especially in New York for people who are incarcerated. That's such a great word, hysteria, because it really can be a place where people really are compelled by stereotypes and prejudices that are existing. Increase in interpersonal violence rates. There's been no guidance regarding, SSD applications and deadlines for that, for sure. Lot of delays and not really thinking of the implications. So not just health and mental health outcomes, but profound economic outcomes as well. Really important. Thank you for those of you bringing those up. And thank you for sharing that New York Times link to an article as well. So yeah, there are lots and lots of practices, of ways that people are stigmatizing. The internalized stigma piece carries with it a lot of important implications for outcomes that many of you have shared. Internalizing stigma, again, that the way in which we are aware of stereotypes and prejudices. It's the AAA, right? The awareness of them, the accepting them, like, yes, this prejudice is true. And then the sort of challenging part for people when they internalize is the accepting it, for the applying it to themselves. So you think of that process, the 3 A's when you think of internalized stigma. Okay. This is me processing what to do next. That was what that was. So we can offer links for all of you to take a look at in your own time. Stigmatizing behaviors have been rampant across the globe. displays of xenophobia and prejudice and xenophobia and discrimination and violence that many of you have shared with us, and against people of East Asian and Southeast Asian descent, but also other populations as well who are experiencing backlashes for many of the reasons we've talked about today. I'm going to move forward. I do want to share this, the second bullet here, about a doctor in Colombia who is asked to leave his apartment because of the fears of him being contagious. And some of you have commented about that happening here as well. In other parts of the world, healthcare providers are being physically attacked as well. So the inaction of stigma is real, and it's evident to us now in particular, and also prior to now, where sometimes we're not paying as much attention as we should to it.
Excuse me, Amy. We
Yeah.
just we have a question, and just like I don't want to miss it here, but can you say the 3 A's again for internalized discrimination?
Sure. So for internalized stigma or self-stigma, the way the process works is you are aware of stereotypes and prejudices that exist, and you then accept it. So I'm aware, and yes, I think it's true. So that sort of affirmation, and then the final piece is the applying it to myself. So if it's true and I am this person, for example, if there's a stereotype about incompetence, and yes, I believe that people with mental illness are incompetent, and I have a mental health challenge, so I am incompetent, right? So it's awareness, acceptance, and application. I'm just going to show this outcome slide. I think everyone has shared a lot about outcomes, individual and collective outcomes for stigma. Our driving sort of message here is to consider that individual and collective outcomes lead to increased morbidity and mortality, comorbidities, significantly impacting quality of life, a lot of mental health outcomes, and ultimately health disparities that are exacerbated by COVID-19, but exist prior to that for sure, and are particularly vulnerable, particularly happening for vulnerable populations and marginalized populations who have been experiencing racism and systemic and historic oppression. So Sam, I think I'll turn it over to you to talk about the structural pieces.
Sure. Yeah, I'm not going to spend too much time on this. I want us to have some discussion about it, but then I also want us to have a little bit of time to get to some strategies and some sort of ending remarks. So I'll try to move through these quickly. Yeah, so building on kind of what we shared about the individual and collective experiences of stigma, racism, and discrimination, I just want to take a few minutes to kind of reflect on some of the institutional, organizational, or structural practices or outcomes that are sort of exacerbated or created during this COVID-19 pandemic. So when we have this discussion, I want you to think about these examples that are higher order. So you'll be hearing, well, there will be trainings later on about policy, and I think they'll address some of these issues as well. But thinking about sort of policies or laws or systems of law enforcement and regulation, and how those can be outcomes, and how they can also resemble drivers and facilitators as well. So Amy talked earlier about how we conceptualize this model of stigma, racism, and discrimination to be very cyclical. So, on the one hand, it might be an outcome in a policy or an institution or practice, but then it can also serve as a facilitator and a driver for sort of furthering this cycle of stigma, racism, and discrimination. And so with that in mind, I'm just gonna, we jump to the next slide. I'm just gonna ask a couple of questions. Again, these are very general questions, and just we'll watch the chat box to see kind of what comes up in the dialogue. The first question is, what are some of the organizational, institutional, or structural outcomes or practices of stigma, racism, and discrimination you have seen, heard about, or experienced during the COVID-19 pandemic? Or how have existing organizational, institutional, or structural outcomes or practices of stigma, racism, and discrimination changed during the COVID-19 pandemic? So thinking about some of these historical pieces or historical institutional or structural drivers or outcomes, and how they might have changed or how they look different now. So I'm going to look to the chat now. So nursing homes, keeping the family out of the loop. Yep. So, you know, who shares information? Who do we share information with? How do we share information? Policies and practices around that. Lack of testing. Yep. Christina shared on internalized experience. Many social workers are of color, and some will look at clients of color assuming that they are worse parents, lazier, etc., resulting in much bigger placement of children of color in the foster care system. Yeah. Lack of access to resources. Sorry, I kind of lost my place here. Exacerbated by loss of jobs, restrictions in transportation, etc. Stigma. Religious Jewish families gathering for funerals in New York. Correctional facilities limiting the ability for providers to connect with clients. Yep. Employers like framing new remote work policies or working from home rather than acknowledging the challenges with like being able to fulfill those expected work responsibilities. Absolutely. The stigma on Jewish practices, escalation of ageism, heightened sensitivity around the so-called vulnerability of the elderly. How can one balance the awareness to rid of stigmatization of incarcerated folks while also being mindful of one's own safety and the dangers related to these individuals not being in the jail system? So that, I think that gets a lot at some of these self-reflective pieces. So we all kind of have the capability of replicating or can be guilty of stigmatizing others. And so really kind of thinking about and breaking down the reflective or reflecting on our biases, what drives, you know, our fear of these particular aspects, what drives our assumptions around safety, and what drives our assumptions around folks who are incarcerated. So I think that's a lot of a reflective process. And if Amy or Tiffany or Chris have a different opinion, it's a good thought. So Asian belonging in the United States is truly conditional with historic context of exploiting or commercializing practices and resources from Asia when it benefits white dominated hierarchies, but then at the same time dehumanizing and stigmatizing them as well. So Chris, thanks for sharing that. Stigma of non-essential workers, social workers not seen. Oh my gosh, it's so hard to keep track of this chat. Yeah, social workers not seen initially as essential workers, although we're constantly on the front lines. Assumption that incarcerated folks won't have a place to go if they are released. Yeah, there's so many, and we got a question in the question and answer piece about whether or not we'd be able to share these chat messages, and so I'll leave that to Tiffany and Chris to answer, but hopefully we will be able to share some of these pieces. I'm not sure about that. So for the sake of trying to move this along, please keep sharing your discussion in the chat box, and Amy or Tiffany or Chris can jump in and call me out if there's something that really needs to be discussed more. But I think we'll just, Go ahead.
I'm just going to throw out, just because I know just kind of keep an eye on a time, and this was a question that was asked earlier, and I just want to make sure it definitely does get touched on before we wrap up. But someone did share how, the school that they're at, one of the students they support is Asian American, and the mom has been a victim of COVID-related hate crimes, and they're doing okay, but wanting to learn some way, like, I guess takeaway, like what are ways that that in our work we can continue supporting clients experiencing racial trauma as the environment continues to be unsafe. And then this attendee asked, especially as a white worker, and I would also add to that, so especially as a white worker, and then also too for other folks of color who are balancing their own response to this while also supporting other clients of color as well too.
Yeah.
That's great. So I think we're going to talk a lot about that when we kind of open it up for discussions about strategies. So what I'll do is I'll breeze through this next section so that we make sure to have the dialogue on that, because I do think that, for many folks who are here today, and for myself and Amy as well, I believe we're really interested in having that discussion around strategies. So how do we support folks in the community who are experiencing stigma or racism or discrimination during this pandemic, whether that be existing or exacerbated by what's happening, and also, sort of some tools we can use to work with folks in reflecting about their own bias. So in our own bias and our own reflection, tools we can use to look at that and to kind of unpack that, but also ones we can use when working with other folks. So with that, I'm just gonna really quickly run through a couple of notes, but mostly I'm gonna skip. You'll have the slides so you can go through these pieces. Amy, will you advance the slide just to one? Yeah. So this came up in some of the chat dialogues and has come up throughout these pieces, but I want us to talk a little bit just briefly about, or reflect on rather, about sort of how these organizational and institutional outcomes of stigma and discrimination are kind of manifesting right now in the COVID-19 pandemic, right? So for example, there's a lot of, we talked a little bit earlier about denial of rights to particular groups, particularly marginal groups, or lacking equal opportunities and resources to access or achieve certain human rights or capabilities. And so, really kind of thinking about how the policies that are being enacted right now might differentially impact different groups. So I encourage you to investigate and reflect on examples of groups of, for example, service workers, and we talked about this and it came up some in the chat, but who need to work in order to support their families for economic reasons through the pandemic, but because of that may be more exposed to the virus because of the nature of that work, and then at the same time are making minimum wage, are lacking medical and health benefits, and have minimal or no paid sick leave. So thinking about that layering of how our policies and how our practices in the community at the institutional, organizational, kind of structural levels really limit or impact people's ability to kind of cope with or mitigate the challenges of this pandemic. Will you skip to slide 35?
Sure.
And this came up, so I want to talk, this came up some in the discussion in the chat as well. So this notion of media, right? And so, media has a really important function in our society, but it's operating in different ways for different folks. And it can be really challenging in this kind of epidemic to kind of weed through what is real and what is not real, or what is helpful and what is not helpful in terms of the dialogue. So I just want to read a tiny excerpt from an article put out by the WHO that was entitled "Facts, Not Fear Will Stop COVID-19. So how should we talk about it?" And it states that an infodemic of misinformation and rumors is spreading more quickly than the current outbreak of the new coronavirus. It doesn't necessarily mean that all media is bad media, but what's challenging is how to weed through kind of what is, what has, for example, a racist undertone, or what has, for example, the influence or the ability to increase stigma, racism, and discrimination among our communities. And that can be really challenging when, one of the strategies for dealing with or kind of reducing stigma and discrimination and racism is access to knowledge and awareness. And, I think all of us are kind of dealing with and struggling with how to make sure that the media and the information that we're digesting is accurate and is sort of promoting or deconstructing systems of oppression in some way, but that can be really challenging. So I just wanted to note that. And then I think I want us to move, and one more quick note, if you just skip to the next slide quickly. So I just wanted to note really quick too, in the same way that our laws and policies are, potentially creating or exacerbating existing stigmas, racism, and discrimination, it's also the law enforcement practices, right? So how are these policies carried out and manifested in our communities? And we're seeing that in the COVID-19 pandemic as well. So some things are being exacerbated, law enforcement practices or authoritarianism, as we talked about. So some of these policies really, the implementation of them or the enforcement and regulation of them can differentially impact different communities. And so thinking about when you're working with clients or when you're working with people in the community or even family members, how different people are impacted or affected. So thinking, for example, about border control and immigration enforcement during this pandemic. How does that look different, or how does that exacerbate the challenges in terms of stigma, racism, and discrimination that folks are already experiencing? And so this is, sorry, I breezed through all of that. It's all here, but I really want us to spend the rest of this time talking about those strategies and tools. And so I want to open up this discussion right now by asking the community that's here to talk a little bit about their experiences of stigma, racism, and discrimination, and like how they talk to their clients or the community members, family members about these issues, and what strategies have worked for talking to folks about this. So for those who don't work, with clients, we have clients up in the question, but for those of you who don't work with clients, it could be family members, it could be friends in the community, it could be community leaders, religious leaders, mobilizers, whoever you're talking to or communicating to about these issues. What has worked for you? What are some of the strategies we can share as a community to think about how to tackle some of these issues? So it's really a lot around, folks who are experiencing stigma, racism, and discrimination.
And Sam, if it's okay with you, while people are commenting, I'll forward to those slides, the strategy slides. And I also want to be mindful, because I don't know if you had a chance to see in the comments about sort of ending on a slightly more uplifting note and a healing note, as Kurt had shared, and I would like, this might help us to get there. So we will, as you're sharing the strategies that you're experienced with and that you're working that have helped you in your work, we'll share some of the ones that we were presenting, knowing that this is not an exhaustive list, for sure. These are things that we've utilized, that are in the literature, and self-awareness is probably the starting place. And many of you have talked about that already today, but starting with ourselves, recognizing our own biases and the beliefs that we hold, and being able to have these conversations with people and check in and be honest, and practicing humility. I'm seeing some people talk about educating clients about the accuracy of people's or media's perspectives, and that flows right into the next strategy, which is enhancing knowledge. The facts, as close to the facts as we can get from trusted sources. It's really hard to find trusted sources, or to know where to go for trusted sources. But very important in learning about not only the facts and myths around this particular pandemic, but also recognizing historic and community trauma and understanding health disparities and the impact of these social causes of disease like racism and stigma. Shaniqua, I quickly saw you talking about sharing stories, and that's sort of reminding me of this strategy. To connect and listen mindfully, to reach out to people who are experiencing these larger structural impacts and ask, how can I support you? Coming back to that question Tiffany had shared with us about the child in the school whose mom had experienced discrimination. And I know, Catherine, you shared a very difficult personal story as well in the chat about your experience with discrimination as you identified with as an Asian American. And first of all, thank you for sharing that. But those of us who are hearing these kind of stories, really asking people, you know, how can I help you work through this, and really take time to listen, paying attention to body language, and hearing, eliciting stories from people, and giving space for that, and giving space to know that we don't need to know the right things to say necessarily, but we do need to be coming into those conversations with open minds and open hearts. This notion of contact is one of the biggest strategies in the mental health stigma world. And I know contact now is a whole different meaning given social distancing measures. But really it's also getting at the recognition of stories and people's experiences, honoring providers and frontline workers who are not providers, who are putting their lives at risk, and promoting opportunities for contact, even in this sort of virtual way. And I'm seeing some really great comments about normalizing fear and anger, listening with an open and gracious heart, with the understanding that everyone has a story worth sharing and validate. I think that's a great comment. Lamikwa, thank you for sharing that, validating people's experiences. Anna, yes, to expand conversations to include more conversations specifically about race and racism. You know, our confliction with talking about stigma and using the concept of stigma, but really wanting to make sure that we're also calling out the experiences that people are having, which is racism, and going back to that historic piece is really important. Bibliotherapy, I love that. The journaling and writing, vulnerability, unconditional positive regard. Sam, feel free to jump in.
Yeah, I might jump in for some of the earlier ones while you were going through. So some of them are talking about the strategies that Amy provided. So validating people's experiences and feelings being first and foremost. Educating by providing, that's not necessarily forcing advice about particular issues, but providing resources and helping to people to sift through the accuracy of, like, for example, the media or what to do in particular situations, how to practice self-care, or how to prevent the spread of the virus. So helping folks to go through the media and try to figure out what is real and what is not real. Referring to community social services and resources locally and sort of beyond that. Empathy and psychoeducation was a piece. Using shared experiences. So somebody said they use movies, groups, and circles to share experiences and process as a group. So that was for school children, but I think that applies beyond that. There's been a lot of group therapy and group work being done in the virtual sphere as well. You know, if people can access that, or thinking about ways to help expand access to those. And then one of the comments was about, you know, expanding not just conversations about racism and race, but also thinking of race on a broader spectrum. So a lot of times when we talk about in social work, the anti-Black racism, we think about that as a spectrum or a scale. And so it doesn't mean just Black and white. It also means that everyone is sort of falling along a scale, and racism exists along that spectrum. Keeping in mind that it's from, that power is at play, right? So racism occurs from a place of power or position of power, and it sort of happens against folks who occupy marginalized or dominated spaces or positions. But yeah, so anti-Asian racism fits within that line. So even when we use the language around anti-Black racism, we're incorporating and talking about the experiences of Asian and Asian presenting folks as well. And so I think that's really important. Yeah, if you want to dive back in, I just wanted to, those came up a little bit while you were talking.
So the other silver lining is this, and I think we can sort of wrap up with this understanding that social workers are positioned in a really brilliant place, if you will, because we can intervene, and we can intervene on multiple levels. I mean, this is what we're good at. This is what we're trained for. There are some mechanisms on the slide here this is a tiny list of places we can intervene, but primarily in facilitating discussion and being able to listen empathetically and mindfully, being able to enhance supports, enhance capacity, enhance people's opportunities for access to myriad resources, advocacy efforts. It is heavy, and it is really difficult, and it's really difficult for all of us. But I think for me, the silver lining is there are things that I'm able to do. And, caring for ourselves is a really great starting point. And I really appreciate the resources people are sharing here as well. And Jill, I don't think it's silly at all. I totally hear you on that. And I'm thinking of my students who are going to be graduating. These are rituals that are part of our community and culture. And it's okay to feel those losses. And I think, I think just being mindful of the fact that there's a lot of hope, and that's a big tenet of psychoeducation, and it's something that I really believe in, and the support that we can garner from one another, the support that I've seen in the chat today gives me a tremendous amount of hope.
And I just wanted to say a couple of things too. We didn't have time to do this, but there were 2 activities that we had integrated into the slide, which you could do at home or think about. But one of the pieces is, in doing this work, is really spending time to question and think about our own biases, our own positionality, and sort of our privilege and power. And so we had some exercises around thinking about how our position, our privilege, and our power might have changed or have different flavors during this COVID-19 pandemic, but also how they relate to sort of in more traditional times. I don't know if that's even a word. I don't like to use the word normal times, but in other times outside of the COVID-19 pandemic, thinking about our privilege and our positionality and doing some of that unpacking so that we can better show up for our clients or our families and communities. And then the other piece was mindfulness workshops. So sometimes taking a moment, 2 minutes, 1 minute, just to do a mindfulness exercise for yourself or with someone else, breathing, reminding people to kind of to breathe and to be present for a moment can help with some of that process. And with that, I think I'll turn it over to Amy to say goodbye. Is that?
Thank you. I think, thank you for bearing with us. There was so much to discuss and share, and we are so appreciative of your vulnerability and sharing, and your willingness to share your knowledge and experiences with us. We will thank our COVID action team members and administrators, and Tiffany and your office has done such an amazing job at supporting all of us, and we're grateful. We're grateful to have had this opportunity. So thank you, everyone, and keep the hope and faith, and we're in it together.
Thank you so much.